Hi, I'm Elizabeth Hess. I'm here with Julie Pryde. She's the administrator of the Champaign-Urbana Public Health District. And before we get started, Julie, I want to say that this community has a vocal voice of opposition and proponents of what's going on, no matter what it is. People complain about everything. However, your staff has done such a phenomenal job at the I Hotel and the Dress Barn administering vaccinations. Something has universally happened, and I have not heard a single complaint. How pleased are you with what's going on so far with the vaccination clinics?
We are very pleased with it. And I have to tell you too, it's not just my staff. I have a relatively small staff as far as vaccinators go. Of course, we have a lot of logistics people there, but these clinics, we all do things individually. Carl, Christy, OSF, U of I, we're all individual until we have a crisis like this. And then we really come together, which is what we're seeing. It's in the plan. We've practiced it. Everybody came together. So, we have the big mall, the big vaccination site up by the mall that Carl's operating. We have the big iHotel one, which is CUPHD, OSF, Christie, McKinley has nurses there. Illinois Fire Service Institute has vaccinators and paramedics there to keep an eye on people. Of course, public health staff as well. So, and then of course we have the CUPHD one going on, which is kind of a catch-up clinic for people who may have been out of state or not available to get their vaccine. When it was their turn, they can come in to get it here with an appointment.
Speaking of turns, I know that you are finished with 75 and up for those who have wanted it, 65 and up with pre-existing conditions. Is that where you are now? And how do you move on to the next phase?
Right now, we're actually at 65 and up. So just being 65 and up is enough to get you in to get your vaccine. If you look at the 1B category, on the state website, it is a huge group of people. It goes from 75 plus, all the way through all kinds of different professions and things. So we had to prioritize within that. So that's what we're doing. We will know when we get to the 65, when we're done with 65 and plus, when we stop getting, overwhelming requests for appointments. So we filled up this week's clinics, and then we'll, see how many we have that are waiting for, vaccines. And then we take that number plus the number of vaccines we will receive in the next week. And we don't have much time on that for planning, but then we'll open it up and we'll say, the next group will be education sector. So that will be people that work in schools. And again, we'll have to prioritize into those who have direct contact and that are at higher risk. So we just keep moving through that until it's the point at which we get enough vaccine that we can just open it up to everyone. So everybody just needs to continue to have patience. And as we get more vaccine, we will keep moving through that.
And you're so well scheduled and tightly scheduled. What happens if you get to the end of the schedule and the nurse holds up a vial and there's still potentially 2 vaccinations left at the bottom of the vial? What do you do with that? Because I know you don't want it to go to waste.
Correct. Well, first of all, we eliminate a lot of that because the nurses aren't drawing up the vaccines at their individual stations. We have at the back, and again, everything is done by appointment. So we know how many are coming each hour, each half hour, whatever. And we have pharmacists back there who are drawing up the vaccine, and they're able to squeeze out, every little drop possible out of the vials. Sometimes we have physicians, sometimes we have nurses as well, but we have basically the same person for that day, drawing up. And that makes it so that we don't have, a lot of waste. We're basically drawing up out of one vial at a time, not multiple vials all over the place. And that's what leads to waste. So if we do have a couple at the end of the day, we will get those into someone, whether that is a staff person that has not yet been eligible, whether it is I don't know. We get them out. I will just say we don't waste any vaccine. That's key. And what happens in a lot of places is you have multiple stations and everybody's drawing up their own vaccine. And that's how you can get waste. Ours is done a little more efficiently in that we just have the one spot for drawing them up. Then they're delivered constantly to the nurses' stations where they're then given to the vaccinators.
Let's talk about numbers. Things have opened up. We've reached a new phase. We have gyms opening up with classes, in-person restaurants. This is because we have hospital bed capacity. Can you tell us where we are with numbers right now in the county?
Sure. So right now, as of today, we have 651 active cases. 24 individuals are hospitalized from Champaign County. We have had 106 deaths. We right now have 956 people in quarantine. I can also give you an update on where we are with vaccinations. We have done 18,000, as of yesterday, 18,671 first doses and 2,334 second doses. So we're up over 20,000 now, which is good. And we'll just keep cranking it in as fast as we can get it.
Since we last spoke last week, we have a new administration at the federal level. What you've heard out of the Biden administration, are we going to see more production and more vaccinations? Are you pleased with what the plan is?
Well, I would be more pleased if it had started, 8-9 months ago. But yes, I mean, we've got to see more vaccine being produced, and more importantly, a plan to get it distributed to the states. Once it gets to the states, Illinois Department of Public Health and their partners do a good job getting it to the local health departments. But we've always needed a national plan to make sure that the vaccine is distributed so that states know what's going on, so then they can tell locals what's going on, but also to make sure that it's distributed equitably so that there aren't states that are getting a huge allotment and they're able to vaccinate their entire state at once, and while others are still waiting to vaccinate their highest risk. So I am more hopeful. And what I'm most hopeful about is the transparency, because we knew all along that there were things being said and done that absolutely were not in any way following science or public health practice or anything. So I am happy to see that will make a big difference.
And you always give credit where credit is due. Our community has done a great job, which is why we're at barely over 5% positivity right now, why things are opening up again. Has anything changed in what you would recommend with people in terms of mask wearing, socially distancing, and washing your hands?
No. In fact, I'm not even going to lie. I'm anxious that everything is opening up like it is because our numbers are down. Now, if I had my way, we would just keep going like that and keep things low so that we're not risking constantly, going back and forth, opening things up, closing things down. But we don't, this is where we are, and businesses can open, but I just need to make it clear to the public that nothing has changed as far as the ability of this virus to make you sick, hospitalize you, and potentially kill you or kill someone you love. So, just because something is open does not mean that you need to change your behavior or even that you should change your behavior. So, keep wearing your mask, keep distancing. It's just not safer, and vaccines are getting out there. So, I really urge people to continue being very cautious so that we can get through this and get everyone vaccinated and get out of this pandemic.
Are you nervous with students coming back that we're going to see a spike, especially with all the pictures circulating over the weekend of students congregating as they do?
Well, the student spike is one thing. It's a little bit different than community spread. And again, it's because of all the controls that the U of I has. So, they're testing the students and the staff constantly over there so that when somebody is positive, they get put into isolation, and then anyone around them gets put into quarantine. So that, in a sense, it's less of the number of cases that come back into the community than because we know that there'll be a spike with that. So we just have to make sure that we are ready with contact tracing and all the supports that we have, and we are. So, we saw a ton of that in the fall. Is it the fall? I'm getting confused on dates. In the fall. So we were able to handle that. It's still, kids on campus, well, they're not kids, young adults on campus still need to be, very careful and take this seriously. We have been seeing people who have gotten this more than once. So there is this sort of belief out there that if you've had it, you're somehow immune to it. That is not the case. So they still need to be vigilant and get us through this time period.
This new variant makes me really nervous. Has that variant or has any other change been detected in this community?
Well, we do have samples of that for that variant out. I mean, the labs are all looking for it. And then once they find an indicator that we may have a change, then they send it to the Centers for Disease Control and Prevention for genetic sequencing. We haven't gotten those results back yet. I will tell you that we assume that it is in our community. So, again, our communities has to be doing a really good job of doing the masking and the distancing, and that is going to help prevent that from spreading. We do know right now, at least, that the vaccine is effective against that new variant, the B.1.1.7. So that's good news. And I also need to let people know that should we get some type of variant that does not, the vaccine no longer works for, they will adjust the vaccine to accordingly. So that can be done. But I hope we don't get to that point. I hope we can get everybody vaccinated and get out of this pandemic before we have anything like that.
I've heard pundits say that double masking is even more effective, or just make sure you get an N95, which are really hard to get your hands on. Is that true? Double masking is smarter right now?
Well, the thing with masks is that they run a wide range. You need at least two layers for a mask, and some of them just are not that good. So either you can wear two masks. That's certainly, obviously it's more effective to have more between you and the outside world, if you will. But also, like my mask that I have has a little pocket in it that you can put a little filter in there. So there's that as well. N95s are not recommended for people to run around in. Those need to be fit tested. They're still in short supply. And but if you want to wear, a paper mask with a cloth mask over it, or two cloth masks, that's perfectly fine. Some people have been doing that since the very beginning of this pandemic.
Let me ask your honest opinion. Are you going to sit in an in-person restaurant right now, or are you going to continue to support the community with takeout?
I am going to continue to support the community restaurants through takeout and abuse my waistline at the same time. I think I've eaten more restaurant food during this pandemic than ever, and yet I have not been inside of a restaurant. So no, I am going to continue doing what I have done throughout, and that is to avoid any situation that requires me to be inside around other people where I'm not masked and not distanced. And that's everything. That includes movies. I won't do anything like that. Even though they can theoretically be done safer, you have to look at what's actually happening in the setting. So just because people are told to wear a mask in a setting, like a movie, you need to know, and you need to be aware when you're in there, are they doing it, or are they taking them off and, eating and drinking and doing all kinds of stuff. So you really need to be your own advocate and really look out for the setting and make that decision. Like, do I want to take this risk?
Julie Pryde, I know that the community knows what a treasure you are, and that you are a multitasker, and that this is rested on your shoulders and the shoulders of your staff, but it's never been more apparent than you answering phones and dealing with computer things constantly. I don't think there's anything that could have depicted what your life is like more than the last 5 minutes. I really appreciate everything you've done. I want to thank Jason Liggett. Jason is our producer. He keeps us online. We're going to keep doing this until we're back to normal. And thank you, Urbana Mayor Diane Marlin, for letting us continue to do this. Julie Pryde, I don't know what you need to do, rip it out of the wall or just pick it up and slam it down like the rest of us.
I just need to not be a boomer. I need to figure out how to use my multi-line phone that I never do. But yes, I am getting a lot of text, a lot of emails, a lot of phone calls, and that's fine. I definitely try to answer them all because I appreciate people getting correct information out there for us. And this community does a great job of that.
We appreciate you, Julie Pryde, Administrator of the Champaign-Urbana Public Health District. You and your staff, we couldn't do it without you. Thank you.